Greetings from a brave new world that none of us could have predicted. The COVID-19 pandemic emerged suddenly and has spread throughout the entire world. And although we regret that we're not together in Paris, we're here today, all of us asking the same question, which is, what can we do to help? I'm Ken Goldberg from UC Berkeley, and I'm with Robin Murphy of Texas A&M. And we put together a group of experts to talk about where robots and automation can be applied to provide service to the field and the challenges we're facing today. Robots have been applied in transportation, they've been used to produce protective equipment, they're being used in hospitals to connect patients with their families, and also to access devices and supplies. People are using robots to communicate in ways that have been not done before, to disinfect areas, to provide safety indoors and outdoors. UAVs and drones have been used both for disinfecting, but also for crowd control and alerting people. There's a renewed interest in using robots for delivery and in retail applications. And a huge area is the massive increase in e-commerce. E-commerce has been growing over the last few years, but during the crisis, there was a dramatic spike in adoption. And combined with the limited ability for human workers in warehouses, there has been a massive increase in demand for robots in warehouses. So as Rod Brooks had said years ago, that a major challenge for robotics to be able to grasp and manipulate objects has now become even more critical. So this is a panel that will continue for the next hour, and we'll start with Robin Murphy.
I'm working with a group of roboticists who've kind of sort of spontaneously come together. Part of us have been there for the Ebola outbreak, but it's called Robotics for Infectious Diseases. And we've pulled together, in particular, one of my graduate students who has pulled together reports. We continue to scrape social media, YouTube, scientific articles, of which there's like one or two, and thanks to Dr. Hauser for pointing some of these out, pulling these together to see. And so as of the early part of this week, we saw 263 reports of ground and aerial robots being used in 21 countries. And even though that's not, clearly accurate as to who's using what where, it does give us some ideas and insights. And I think you'll find them fascinating. Okay, if we look at the instances by category of application and by who would be the adopter, we basically break it into these groups. You're seeing the majority of the press and reports are about government using this for public safety, public works, public health, which is probably a surprise. But the runner-up is hospitals for clinical care. We also see, as Ken alluded to, now we're seeing a huge interest in continuity of work and education. And that also, we see the laboratory and supply chain automation for the medical industry has become very important. Quality of life, how we as individuals are coping, some surprising results there. And then we have non-hospital care, such as people who are sheltering in place, quarantining on a boat or in a nursing home. Okay, if we look at the applications a little bit more in detail, you'll see that public safety is particularly focused on quarantine enforcement, seeing if people are out and about when they shouldn't be, and on the idea of disinfecting public spaces. And that's a public works, public health, public safety kind of combination. Clinical care, in the early part of this, throughout the month of April, the reports were all about disinfecting robots, the Xenex, the UVD, UVC robots, but we see them now shifting, a lot of attention being placed on telepresence for healthcare. Continuity of work and education, first off, let's clean up those places to get people back. How are we using telepresence for work and warehouse automation? A laboratory and supply chain automation, we're seeing a lot of interest in medical delivery for infectious samples and also for material handling. Quality of life, huge increase in those things. Besides the obvious delivering food and non-food purchases, people are coming up with great ways of using robots for interpersonalizing, socializing, including things like proposing with a drone, attending public social events and other things. And then, of course, nursing homes, we know the telepresence there. Okay, if we look, I think what's really exciting is what are the new markets or applications that we really hadn't been talking about or hadn't seen any real increase in market share. And so that disinfecting public spaces is new, sanitation of work and school, handling infectious diseases, how in particular the quality of life ones. Those are all new things that are showing up. And let's look at whether it's ground or aerial robots. At this time, there are no reports of water-based robots, although some lifeguards are looking at that. And if you can see, the blue boxes mean the majority of those uses are aerial vehicles. The brown boxes mean the majority are ground vehicles. And if it's neither, then it means it's a 50-50 split. And so what's exciting about this is that the ground robots are there, but look how much aerial vehicles are coming in. And they're certainly dominating the public safety aspect. And we're seeing a lot of creative uses of that for quality of life. So people are experimenting with drones in a lot of ways. So in summary, it's amazing. COVID as the use of robots spans all aspects of life. About half of the reported applications appear to be new and creative uses. Ground robots dominate, but aerial vehicles are playing a notable role. And I think that finally we're seeing a breakthrough in adoption for work and education and for the quality of life.
Antonio, you're going to respond.
That was very nice, Robin. I really appreciated the breadth of the view. Now in Italy, we are living a transition from phase 1, the complete lockdown, to phase 2, where we are gradually reopening and people are going back to work with a lot of caution. I wonder if you see that this change will also change the attitude of robotics and will change the role of robotics from the emergency, from coping with the emergency as we did so far, into allowing us to have a better organization of our work and life in the near future.
I think it absolutely will, Antonio. I mean, when we first started tracking the reports, it was all about clinical care and public safety. Now we're seeing it's about continuity of work and education and quality of life. And it seems very clear that people now accept robots, that this is something that they should do. And so I think this is our breakthrough moment.
Very good. Thank you so much. This is we're going to turn things over to Ayanna now, and she's going to give us a report from a different perspective. I think it's extremely valuable. Ayanna, there you go. And we'll let you have the floor.
So what I'm going to talk about, I'm excited to be a roboticist, but my word and what I'm going to talk about is the things that we need to think about so that we do it right. And so this is from thinking about the fact that there's a human as part of the equation. With human comes all of the social biases and all the issues we tend to have already that I worry we might inherit and put into our systems as we deploy. And so these are the dangers I'm talking about. Society, as was mentioned, is starting to embrace robots. Like they were saying, oh, I don't really care that maybe it has this little bit of an issue. I need this because I worry about the risk. And so if you think about all the applications that are out there, Robin mentioned some, there's an accelerated use. These robots are out there, and even some entertainment things like functioning as the humans in ball games and telepresence robots for graduation. These are things that people were starting to accept and say, I'm okay with this robot. And so it's like we're taking the robots out of the lab into real society. But people, though, are human, right? And one of the things is as we spend less time with those outside of our networks, our bonds to those are going to decrease. And with that will become an increase in our overtrust of these robotic systems. And companies will continue to adopt and they will replace people. and we will become used to robots. And so I worry about that. And so the issues that I think about just in general is, how do we ensure that as society gets more comfortable, how do we ensure that we train these systems correctly, that we're mindful of the biases we might introduce, that we are inclusive of those who are from other places, I'm going back, the other places, so that our systems are inclusive. I mean, we already now see that the digital divide we always imagined was there. It exists. Students have no access in some cases to educational AI agents. And so we need to really be inclusive for those with under-resourced communities and things like that. And so although we're living in this unprecedented time, we need to think when we deploy these robots that it's for society and everyone in society. And we need to make sure it's accessible and inclusive of everything. Otherwise, we will have a tech backlash, and that's a crisis of another. It'll be the robotics tech backlash, which I don't think any of us really want. And so I'm excited, but we do need to be mindful of how we do it to make sure that afterwards, when we're on the other side, that we have a better world and we haven't messed it up because of our technology. So that's what I worry about.
Thank you, Ayanna. That's a very valuable perspective. And as all these attitudes are changing, we're in this environment where the impact is not equally distributed. It's absolutely true. And I think it's really important for all of us to keep in mind. Some people are suffering extremely under these circumstances. One example is that the deaf community has talked about the idea that we're now, with people wearing masks, it's impossible to read lips. So it's a huge imposition and disadvantage for them. And I think there, as you said, we have to be very careful and respectful as we move forward. Are there any other guidelines that you would suggest to us in terms of keeping this in mind?
Yeah, so I think one of the things about it is that we're in this high risk, time critical. So we're trying to deploy. I think when we're trying to deploy, we need to really just pause and say, okay, we also need to be concerned about who are we impacting, and just be conscious, be mindful of it from the beginning versus after the fact. And so I think it's not an easy solution, but at least that starts the conversation.
Excellent. Okay, great. Thank you so much, Ayanna. All right, we're going to switch over to Brad now. And Brad and Guang-Zhong are going to give us an update on how the COVID-19 pandemic has affected surgical robotics. Brad?
Thanks, Ken. Yeah, I'm going to talk on the clinical care side, but I'm going to focus on just a portion of that, and that is on surgical robotics, as we've seen the impact of this pandemic in hospitals. We realize that the use case we've been considering medical robotics for, surgical robotics specifically, is shifting. And I think if we go back and think about the origins of the idea of using robots in surgery, it really came from DARPA, from military. The military was interested in moving surgeons away from the front line. This is a picture from World War II. Where the surgery is right there, almost at the battle line, and the idea was to move this back, and this started taking off in the 1980s and 1990s, and then in 2001, this is an example of the first teleoperated surgery. This was performed. Patient was in Strasbourg, France, and the surgeons were at New York University. They were in New York City, and they used the Zeus robot at the time to perform a gallbladder surgery on a 68-year-old woman. And this is, of course, an important step. It's interesting, this is in September 2001. It didn't quite get the press, maybe, because we had another a big event in the world right as this was happening, which was 9/11. And of course, the gold standard right now then for medical robotics is Intuitive Surgical, and the commercial success they've had, and the therapeutic success with more than 5 million procedures and more than 5,000 systems in the world. The whole field right now is exploding. Lots of startups, lots of investment. We've seen a lot of really exciting things coming to market, particularly just recently our endovascular procedures. And this again comes back to the idea of removing surgeons from harm's way instead of from war. In this case, these are some companies that have gotten some traction lately, particularly on the right, Corindus, RoboCat, and Micro Robot Medical out of Israel. And their goal isn't, of course, to remove surgeon from the battlefield, but to protect them from harmful X-rays, fluoroscopy, and that was a big part of their business case. Not the only part of their business case, but a big part of the advantage was removing surgeon for that. Yeah.
Brad, just sorry. There's someone in the background who has some sound. If someone could mute. I don't think it's you, Brad, but someone else on the call, just so we can hear you clearly. Oh, good. Thank you. Whoever did
Great.
that.
So anyway, in this case, you see the surgeons and the nurses that are the goal is to remove them from these harmful X-rays, and one of the state of the art here is a system here in Switzerland in which you see the surgeon operating on a female patient who's by herself. She's doing a heart ablation procedure. But the use case here is originally was to move the surgeons from the harmful X-rays, but we're also, during these procedures, you've got surgeons that have to stand right next to the patient for sometimes hours at a time performing these, and so this is also one of the new selling points or new advantages of these systems is protecting the patient and the surgeon from spread of disease, and that's something that people are much more actively considering right now. So I think. When we look at robotics in the age of pandemics, there's a lot of potential applications, but what I'm interested in, what we've been considering is how we can consider this from an infectious disease protection between patients and surgeons. So thank you very much.
Terrific. Thank you so much, Brad. And Guang-Zhong. Howie Choset is here from Carnegie Mellon to respond to that. Howie?
Yes, thank you, Ken. Brad, thank you for your talk. Clearly our focus should be on responding to the COVID-19 situation, but the reality is hospitals still need to be in business, they still need to function, and one of the things that they're suffering from is a lack of performing elective surgeries. So I was wondering, in your thinking, how can we have the dual benefit, the dual use of still serving that need so the hospitals can persist throughout this pandemic?
Yeah, that's an excellent point. A lot of hospitals at the height of the pandemic, at the height of the infection, actually stopped all elective surgeries. A lot of that reason was to make sure there was enough staff, intensive care facilities for COVID patients. But if we can create systems that actually allow these surgeries to continue without worrying about the threat of disease, that's very important, because this has had a tremendous impact on the bottom line of these hospitals. A lot of them are in dire financial straits, and I know a lot of hospitals are laying off people, reducing salaries because they simply aren't performing the procedures that are paying a lot of the bills. And so I think that's also an important business case for surgical robotics during a time like this.
All right, thank you.
There's also been, thank you both. There's also been quite a bit of interest in replacing the number of personnel in the operating room under the pandemic, because currently there's just every new person adds to the potential for infection. So there's more interest in telepresence in the operating room. All right, very good. Thank you so much. And next we have Kris Hauser from University of Illinois to give us his perspective. Kris.
Great, yeah, thank you, Ken. Brad has been talking about surgical robotics, and I'd like to bring up kind of non-surgical uses of robots in hospitals. The non-surgical area is one in which the nurses, doctors, and other medical staff are the front line of pandemic response, are the ones who are the most at risk of contracting the disease. And also patients can also contract the disease from the hospital environment itself. And so this brings up two potential opportunities for robots in hospitals to help with the crisis. The first general area is care delivery, where the robots can serve as a mechanism to minimize contact between the patient and the medical personnel, either as a medium of communication or of actual care. And this helps potentially reduce the disease transmission inside the hospital, and also helps the doctors and nurses, medical staff, from using up PPE that is oftentimes in short supply, especially during the first stages of pandemic response. And the second area is surface disinfection, because hospitals will be used by sick people, both who have COVID as well as other diseases. You really want to keep those areas clean, and so surface disinfection is a big area that robotics has been proposed for. So I'll talk about the first one, care delivery. Right now, one of the most widespread uses of robots in or technology in care delivery is in telemedicine. This is with your smartphone or tablet. People are already doing doctor's visits through telemedicine, and this greatly minimizes the need for direct contact and travel inside of hospitals and clinics. And on top of this, people have been building robotic platforms that use telemedicine capabilities as well as mobility. So these robots are able to travel around various hospital rooms, and this is helpful for intake of patients where you don't necessarily have the ability to set up screens and so on for people to use. You just basically have one robot that can service multiple rooms. This also helps nurses make rounds around different hospital wards to see multiple patients and communicate with them. On the more advanced applications of robots and care delivery, there are many solutions for automation. So this includes both communication, but also monitoring of patients, as well as delivery of food and medicine. And if we're to think about the future of robots and care delivery, one natural idea might be to say, well, why don't we actually remove the human contact between the nurse and the patient through some large fraction of the activities that they need to perform? So can we actually use robots to treat patients, perhaps in a teleoperated fashion or in a partially automated fashion? On the disinfection side, it is actually really hard to disinfect properly. It's very easy for staff to overlook various areas. They're oftentimes in a hurry, and it's also very hard to deep clean various situations. And so even in hospitals as well as in other care facilities, disinfection is a big area. And we've seen a lot of reports on these UV disinfection robots. These are mobile robots that have UV lights that can disinfect these areas. The problem with the UV light is that it requires you to evacuate the area of people, and it also takes quite a bit of time to disinfect these areas. Furthermore, they're not able to access all areas of an environment, so you typically need a first kind of shallow clean, and then these can be used for deep cleaning. And so in terms of looking ahead towards the future of where robots can help, we can achieve better UV coverage using robot arms. So there are a couple of preliminary projects investigating this, where you can use full 6 degrees of freedom planning and coverage planning to be able to cover the entire surface and without endangering humans. There's also the possibility of using robots to actually wipe down surfaces, much like human cleaners do. These might be faster than UV disinfection, but it's a potentially promising technology. Still all early stage research.
Great. Thank you so much, Kris. I like the motion planning aspect of disinfecting. Howie, would you please respond?
Yeah, Kris, thank you for the talk. I'm curious, the robots are disinfecting the workplaces. What's disinfecting the robots?
Yeah, that's a very good question, Howie. So this is something that is actually difficult for roboticists to really think about, because we typically deal with electronics and fans and all these things that are really not sealed off from the environment. If you can't really just soak your robot into some disinfectant and hope that it gets clean and none of the parts get damaged. So really you have to design the robots with a lot of care in terms of preventing ingress of liquids and so on. The other thing that might be very interesting is to look at robot PPE. So actually putting coverings over robots, basically robot clothes, that can be disposed of maybe at the end of a shift, just like human PPE.
So do you envision any dual use is for any of these applications, either disinfecting or maintaining an offset distance for the caregiver in any of these applications you suggested that may be outside the COVID-19?
Yeah, absolutely. So in terms of contact with the patient, I think that rural healthcare is one really important area. And in terms of disinfecting, we obviously would like to disinfect public spaces as well. So subway cars, buses, and so on. I think that would be a great deal of use.
Okay, thank you.
Great, thank you both. Okay, we have Kerstin Thurow, who's professor in the University of Rostock and heads a Center for Life Science Automation. So as Kris just mentioned, automation is being used for monitoring. She'll give us a perspective of how it's being used in the laboratories.
Thank you very much for inviting me for this panel. Founded in 2003, CELISCA's research and development work is focused on the automation of processes in life science laboratories. And our goal is the development of a fully automated laboratory as a distributed technical system with human impact. With the start of the COVID-19 pandemic, we see some changes in the requirements for modern laboratory automation. Automation solutions are increasingly required by primary medical diagnostic laboratories, which are faced with an increasing number of patient samples to be tested. A second group, what we see, is research laboratories, which deal very intensively with the virus with the aim of developing new medicines and vaccination. And on the third hand, where are developers of manual kits for COVID-19 diagnostics who request their processes to be automated and on commercial platforms. Automation should increase the speed of the process as well as the throughput for more test capacities. And in addition, there's a high demand for higher safety especially for all the personnel working in this field. One example that we recently completed was the automation of a previously FDA-approved manual test procedure. This test procedure enables the reliable COVID-19 diagnostics within 30 minutes, which is very short. And the client was interested in automating or in transferring the manual process to a commercially platform. In addition to liquid handling, reliable opening and closing of the patient samples and flexible barcode detection had to be implemented. The result is a system which enables automated barcode reading on cartridges and patient samples. Application-specific racks were developed and installed on a commercial platform together with a reliable mechanism for automated opening and closing of the sample tubes. The system is able to sequentially process up to 16 patient samples and can easily be adapted to any other processes. Another example is speeding up sample processing. Solid phase extractions are used for RNA isolation and cleanup. However, we often represent very labor-intensive processes and we require the handling of infectious materials. The aim of the development in this case was a complete automation and parallelization of the cleanup process and thus an increase in throughput. A developed positive pressure solid phase extraction unit was adapted to COVID-19 analysis and integrated on a commercial platform. The system enables parallel processing of numerous samples and optionally, if required, the integration of a robot for supplying and removal of labware, reagents and samples can also be integrated. In summary, it can be said that current COVID-19 pandemic has a remarkable influence on current developments in the field of laboratory automation. We see an increasing need to automate initial sample preparation steps and transfer manual processes to commercial platforms. Characteristic here is the requirement of single sample handling, whereby a multitude of different formats have to be handled. Further requirements will arise in the area of automated sample delivery. The primary goal overall is to increase the throughput rates. And I think that this trend will continue to intensify in the coming months with the increasing development also in the field of new test methods for COVID-19 antibodies. Thank you.
Thank you so much, Kerstin. That was a wonderful amount of new work that's been done in such a short term. I'm curious about the now need that will be added, which is to continue testing at a dramatically increased scale. And I'm curious if there's interest in or progress in distributing these laboratories all around throughout environments, because we won't have the luxury of being able to transport these samples as easily. So could there be mini laboratories, like automation laboratories, that could be set up and put into every hospital, every, let's say, school or university?
Yeah, definitely. I think so. The solutions I showed you were very small solutions. We were all based on classical, commercially available liquid handlers, but many people or many laboratories already have available. So what we do, we just add additional equipment to enable the use of these equipment for COVID-19 testing. And this makes it very easy for small laboratories, for everybody all over the world, really to use these systems, especially in terms of testing more and more people right now.
Excellent. Okay, great. Thank you so much, Kerstin. Terrific. And we're going to next switch over to Helen Grenier, who's been a pioneer in robotics and specifically UAVs for many years. She is going to give a perspective on the use of drones, and I have her slides, so I'll share the screen.
Drones for pandemic response. They've been used in pandemic response. They're going to continue to be used, and with even more invention, the uses are just going to accelerate. So I'm going to describe some today. The first is security. Next, they're being used by police to keep police at a safer standoff distance, while being able to effectively monitor a crowd. Next, for being used safety, these same drones can be used to go further and give recommended safety behaviors, like travel is prohibited unless there are exceptional circumstances. This is my best robot voice. Or please respect the safety distances. So they're actually starting to interact with the crowds. The next, search and rescue. Drones have been, well, for many decades, people tried to fly drones to find missing people, search and rescue, but they were denied by the FAA. But now it's almost standard procedure. This picture shows in April, a rescue of a missing child in North Dakota, finding a missing child, I shouldn't say rescue. And crowds roaming the streets looking for them were not needed, which is great in the face of a pandemic. And I expect, and I hope there's not, but if there's a disaster while we're fighting this pandemic, drones will help in the disaster management. Next one, sanitizing. Ultraviolet light has been found to destroy viruses and many other microbes on surfaces, as was mentioned, but it's not just in hospitals. It can be in classrooms, it can be in sporting facilities. I should mention that UV sanitizers, I don't know if they've been tested against the novel coronavirus yet. That's information I'd like to have. But they have been shown to destroy related coronaviruses. So you can imagine these, we're talking about the difference between ground and air. If you have a large, long floor, I think a ground robot, but if you have desks and chairs and maybe cubby holes and things in the environment, I think having a drone perform this task would be wonderful. Drones are also used for spraying chemical sanitizers. There are a few companies doing this, like Fly, Dragon Systems, DJI, and they were already making drones for agricultural spraying, so they were really ready for this, this very new application. So they're making use of existing technologies quickly. Next one, samples. I think early last February, we were reading, coming out of China, a drone flying from a Chinese hospital to a Chinese CDC center with samples that it would have taken much longer to deliver by ground transportation. Instead of 20 minutes, took only 6 minutes. And we would look to a day where you can just deliver a sample kit and the person does their own home sample and gets the results when these sample kits exist. And no human needs to come into contact to get a result. So that would be wonderful. Zipline is a drone delivery service company. They have been delivering medical equipment in Africa, but they're also now looking and performing some sample collection in rural areas and delivering them to medical laboratories. Next. And supplies. I've been an advocate and worked on, with UPS actually, drone delivery for consumer use. But now in this landscape, we have some difficult landscapes across the world, and like the Anzing Islands in China, and sometimes the ferries have stopped working. The airplanes that used to access, or the public transportation that was needed for deliveries has gone down. JD in China did all the groundwork to get immediately starting drone delivery to some of these outlying areas, so people could get the supplies and the food that they needed. And then right here in the United States, UPS and CVS have started drone delivery prescription medication in the Villages retirement community in Florida. So in conclusion, drones have been a key element in virus response, but I think more research is going to be needed to get more range, payload, autonomy, interaction with the environment, and people are also just critical areas to increase performance and expand these promising usages. Over.
Thank you, Helen. Robin?
Helen, what a great assessment and list of uses of robots, of the UAVs. And they have been so important in the last 5 years, particularly in the last 3. We're really accelerating them. Now, in our work, we found multiple reports of people getting very angry about the police using drones for enforcing shelter-in-place restrictions. The WHO, World Health Organization, has said, hey, disinfectants, stop doing it. You've got to really consider environmental impacts, and it's not sure everybody's using the right stuff for this massive spraying. Are you concerned about that, or do you see that will be smoothed over, that the good uses will outweigh?
I think in an emergency, people do tend to cut corners, and those corners have to, you have to go back and fill in the safety requirements. But I see it like in a camera system. People had a lot of issues with police using camera systems, but when we saw some of these videos coming back that many of us would never ever have believed, then people start to say, okay, maybe these can have a positive impact. And I think people tend to get used to the technologies as long as it's, as you mentioned, done safely.
Thank you, Helen. Thank you, Robin. Antonio.
Hi, I'm now telling you more of a story of what we have done in Italy and the methodology that we followed. This is the Institute of Robotics and Intelligent Machines that was just started last year when in 2019 we started this institute that collects all the community. So I'm going to give a report of what happened since then. It was started well, a big effort, a big community effort, and then Italy was hit early and very hard by the coronavirus. So the whole community started meeting every day until mid-April, now from February until April. Now we do that weekly. And we had a strategy to tackle the emergency. First, listen to the needs. Second, come up with a short-term response. And then also highlight the pilot projects that might help in the future. So first, listen to the needs. We started interviewing a lot of people that were exposed to the risk. We had a questionnaire also, and we got the answers. Here are the outcomes of the questionnaire. Those are Italian words that were most frequent. But what comes out was that we understood much better what was the most urgent things. This was phase 1. This was the very high peak of emergency in Italy that came before some other nations. At the end of this, now we have got this feedback, and we are moving to phase 2, another questionnaire where you have maybe less attention to acute clinical conditions, more social interaction, jobs involved in physical interaction with objects and people, and we have a more methodologically correct position with company representatives, unions, social scientists, psychologists. I think this is important in planning for our activities. Pilot projects, we also did this survey of existing technology from robotics that is being proven already in clinical or lab environments, although maybe not yet available commercially. It has been classified. We have more than 70 pilots listed there. If you go to the website, you will see them, and you can check this database. And here are some of the results. So as you can see, there are a good number of projects from North America, Asia, and Europe. Of course, Italy is overrepresented because of the fact that we are Italian. These are the fields where the technology has been made available. But most important, I think, is the question that we got the very first week of the emergency. So anyway, those robots that you talk about, where are they now that we need them? And this was something that was in the newspapers, was in the media. And it was also in our own thinking. And that luckily, in some sense, we had posed our question to ourselves even before the media asked this question. Robots in emergency need to provide answers now and wherever needed, not just in labs or in few hospitals. That was the motivation to start something that would make it possible to deploy robots in the emergency. And to make technology available and deployable, we made a coalition with world of makers and created this Tech for Care, which is basically a matching point between the needs that we have identified, the solutions that research comes with, and makers that can produce it on the market. So here are a few projects that the Italian community has developed in these months. I will only focus on this one, which is the one I know best. It's a low-hanging fruit, picking these low-hanging fruits to make them available right now, wherever they are needed. So it's basically telepresence, which is a big demand because of the people isolated and immobilized. They're not available in large quantities because there is no market so far, but instead vacuum cleaners are in large stock. So we modified the existing hardware with new open software and made the project open and available to makers to build. This was made possible by courtesy of iRobot, who opened the software for Roomba. And then LHF Connect is a fully documented open project to build a telepresence robot with available hardware that you can order on e-commerce and open software at around 1,000 euros. These are the institutions who provided. And here is a video that shows the robot going to the room of a person in a hospital. The person interacts with a pilot that makes her in connection with her family. And here, this person hadn't seen the people in his in her family for some time.
Oh, we can't hear the audio, Antonio.
You cannot?
No, because it's
okay. So that's too bad, but you can read the captions. And let me just conclude here. This has been replied already in several institutions, not only hospitals. It is active in a COVID area and also in elderly care homes where this has been, this is completely open. You don't need to buy anything except the components that are commercial. Here is the team that made this, and this concludes my presentation. Thank you.
Great. Thank you, Antonio. Our hearts go out to you in Italy because you suffered so early with such the crisis of hospital beds, but was served as a warning to the rest of the world. Ayanna, if you have a moment to respond.
Yeah, Antonio, thank you for that presentation. You hit things about community involvement, access, and really pushing it out. So my question to you is, how do we continue doing this kind of work to make sure that we involve the community and we do the reproducibility of robot hardware after there's not this drastic need? Suggestions?
Well, there are two things. First of all, the change of focus. Now we have to work towards phase 2 and the new needs that are there. We still need to listen. We've learned a lot by listening to the real needs, and this is a lesson that we learned, in our profession, I would say. And of course, solutions such as the one that we did as just good for emergency. To be sustainable, there must be an economy. So companies, startups have to produce new robots. But as many as said already, times are good. for robotics, although they are not good for us as a society. But for robotics, it's clearly the time to help. And I think we are ready there.
Thank you, Antonio. Thank you so much. And our last speaker today is going to be Richard Voyles from Purdue with a joint presentation with Gangtie Zheng from Tsinghua. Richard?
What I'm going to talk about is, like many of my colleagues, I continue to be excited about the future of robotics because I was involved in the Ebola crisis back in 2014 from the perspective of NSF and the White House OSTP. And it's interesting, what new things we're learning now and what has stayed the same. Worker safety is a big issue, as many of my colleagues have pointed out. That particularly with healthcare workers, obviously with infectious disease, as Dr. Hauser pointed out, hospital and healthcare workers are on the front lines of the disease. And again, we saw this in Ebola. This highlighted numerous ways because Ebola was so deadly. COVID-19 is about 10 to 20 times as deadly as the common flu. But Ebola was about 10 to 20 times as deadly as COVID-19. And so care workers, including Red Cross volunteers, where the hard-hit regions of Western Africa face these huge risks. And so I'm going to talk about a few specific cases in robotic applications. Again, this is some coming in direct contact with infected poses risks, and it's necessary for patient comfort and for diagnosis. So teleoperated robots can help here. This is Professor Zheng's work from Tsinghua. He developed this robot to provide standoff distance to promote the healthcare worker's safety. It assists with diagnosis and still provides the comfort of a human care worker. It combines teleoperation with supervised autonomy. Dr. Zheng's robot can manipulate a stethoscope, for example, for heart and lung examinations, for ultrasound, for quantitative or internal organ exams. And these are both intrinsically force accommodating procedures that make use of force condition sensing in addition to manual remote control. Taking temperatures is also a necessary step, and we have non-contact thermometers that his robot could automatically do face recognition. Throat swabbing here is, this is a difficult and is still in development as a bite block is needed, but that shows some work. But the bottom line is, these robots were actually tested in Beijing and Wuhan Chinese hospitals, and software interfaces available via open source. But the risk to retail workers was a big surprise, I think, during the COVID-19 pandemic compared to Ebola, which didn't touch the U.S. as much, but did have profound impacts particularly in Alaska. And this was, even though we knew about this, markets for centuries have been, key vectors in infectious disease spread. But in the US, for example, few of us predicted a run on toilet paper, right? I mean, this commodity retail suddenly became front line on the COVID fight. And some low-wage workers were getting hazard pay in some cases. Some of the things that, and pardon the plug, this is some work we're doing on an open source robot that the use of UVC has been popular, but we can't expose humans to it. And so we've done an approach to hiding with a group from hiding the UV basically to just disinfect, because in the retail at a grocery store, typically there are 4 operations: things performed overnight, tasks performed every 2 hours, tasks performed every 1 hour, tasks performed every customer. All those have to be with human in the loop. And we talked about robot PPE, right? Yeah, we're working with nanotechnologists on filter layers that can prevent biological stuff spread on the robot to keep it clean. And so these are just some of the things that I think that we need that take transdisciplinary approaches to robotics in response. Thanks.
Thank you, Richard. Kris, we have time for just a very quick question, if you will.
Sure. So I guess, as Ayanna pointed out, acceptance of robots is a big factor. Have you thought about the kind of impact that robots would have on kind of worker acceptance in these domains, both hospitals and...
Absolutely. You know, we have had some experimental trials in a number of cases in hospitals, and yeah, this is one of the things that both doctors and patients say is it's really important to have the human in the loop. I mean, we're talking about comfort care, and the same is really true. Although we're moving more in retail, we're moving more to online purchases where people are more used to. But if they're coming into brick and mortar stores, you know, a lot of that reason is for personalized care, and so the grocery stores really want to keep these robots off to the sidelines.
Thanks.
Thank you. Robin and I want to thank all of the panelists for their contributions, and Wolfram Burgard for initiating this panel, and advisors such as Andrew Kie, Erico Guizzo, and Evan Ackerman from IEEE Spectrum, who shared a number of other ideas. So much has changed. We have a new appreciation for human contact and the potential for robots around the world to support us and keep us safe in the years ahead. We look forward to continuing this discussion during the conference.